Welcome to the May meeting of the Cumberland County Commissioners. I'm Commissioner Neil James, and I'm the chair. And for those folks who would like to join us, we will start with a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is the approval of the April meeting minutes. Is there a second? Second. Any discussion? Seeing none, all those in favor to approve the April meeting minutes? Aye. Aye. Nay? Passes 5.
Was I abstained because I wasn't here?
Passes 4-0 with one abstention. Thank you. The next item on our agenda is an informational report from the Sheriff's Office regarding body cameras and tasers. Sheriff Joyce, please.
Thank you. So I met with the staff today, and we're working on a policy. The policy's been kind of in place, but it's in stages. We should finalize that in the next 2 days. We have Axon people coming to kind of go over the various nuances of what we can do, what we can't do, how to set up the cameras, et cetera. So once we have that, we should be able to finalize that in this week or the first of next week. The FOIA position, that job description has been drafted, reviewed again, and is on HR's desk. So we should be all set with that. We do have the equipment. We've had the equipment. As far as I know, the bills have been paid. So all of that has been really inputted into a program called I can't find it, but there's a program. It's all amortized, and we have it listed, so when we start handing it out, we know where each camera's going, where each taser's going. Evidence.com, AxonEvidence.com is a program. So that's all set up, ready to go. We haven't deployed the tasers because of we want to have the company come in and actually check them, make sure they're working correctly. So again, they're in town today, tomorrow, and Wednesday, and they'll be working on that. Then there's a little bit of training that goes with the tasers. We hope to get those into the field this month, especially with firearms coming out. Like I mentioned, on Wednesday and Thursday, there'll be training. No, Tuesday and Wednesday, there'll be training. And at the end, about a third of the agency will be trained on the cameras and ready to go on that. And really, other than that, we've reached out to the 3 school districts that we deal with to make sure that the superintendents are all set with the video cameras, and you know, they're all set with it, so there's no issues there. We're going to address that in the policy. So it's kind of where we're at. A lot of things will happen fast. Once we get the FOIA person, because we don't want to open the doors to getting FOIA requests without somebody to process them, because we feel like that once the door is open, people are going to flood in. So once that position is filled, we get some training, we're going to roll the body cameras out into the field.
Any questions for Kevin? Go ahead.
Just one question. You mentioned a third of the agency will be trained.
Yes.
What about the 2/3 of the other part?
Oh, we're gonna do that before they get the cameras. But this week, by virtue of Axon being here and training most of us, then after that, the training will go a lot quicker.
Okay, so everyone will be trained
Oh, yes.
in a month or two or something like that?
Well, yeah, hopefully by the end of May into June,
Okay,
if everything goes well.
thank you.
Jim?
Sheriff, what's the understanding, if there is one yet, on how requests and copies of whatever is available, how that will be handled in terms of any charges that might be assessed related to that? Is there an outline of how that works at this point?
Well, we're still putting that together, but, I mean, generally, if it's FOIA-able and Lieutenant Foster's worked with FOIA requests, so not that it's been involved with media, but if it's something that is part of a case, then we've got to release that to the defense attorney for discovery, as well as the district attorney. If it's something that, you know, questions a person's integrity on the road and stuff, we'll probably talk to a county attorney before we release that. And then as of recently, there was some statute that requires the Attorney General's office to release video cameras as soon as they practically can without jeopardizing the case. So it's kind of one of those that we'll probably, like I explained to the lieutenant that was briefing us today, we probably haven't thought of everything. And as soon as we open the door, something's going to come up and we're going to have to move and shake with it, so.
Okay, thanks.
Any other questions or comments? Sheriff?
Thank you.
Thank you. Oh, yes, I'm sorry.
Sheriff, what's the take of the union? Have you heard any scuttlebutt from the union on this policy that you're creating, and what's their opinion of it?
I hear mixed messages. I don't know if any of it's accurate because I've not heard it directly. You know, they've been working on the policy. There's, there was a rumor that it's a change in work conditions, but nobody's expressed that to me directly. So I can't really tell you, other than what I'm hearing. But they've been, you know, I know that we wanted it discussed during the contract negotiations, that, you know, so we didn't have to deal with this on the 11th hour. So I kind of thought during contract negotiations, some of this was taken care of, but I was shocked to see or hear
They
that.
kicked it to the labor management meetings.
Yeah, and, I mean, they've been working along with us on the policies and stuff, so that everybody's on board, but, again, I can't, nobody's said it directly to me that, there's any pushback, so.
Thank you.
Thank you.
Yeah.
Comments from the public. Are there any members of the public who would like to make a comment here this evening? All right, seeing none, we will move on to the consent agenda. Do I have a motion?
Move the consent agenda.
Second.
It's been moved and seconded that we pass the consent agenda. Are there any questions?
Can I pull something out, but just to have some clarification on it?
Commissioner Mortonis, what would you like to pull out?
But the new pay rate. for
So
the-
23031?
Yes. My concern, and well, maybe it's not, how is that going to affect us to get a person to do, an overtime that's not with detail? Would they take with the detail and not an overtime shift? So it's gonna make us kind of even shorter on the roads? I'm just concerned that with the new rate of the $85 an hour, what is the deputy gonna take? Is he gonna take with the detail, or?
So, it's hard to say. You know, at the old rate, nobody was taking the details anyway. We have two ways of looking at it. There's a detail rate, which this is the detail rate, and that's if they do like a high school dance or something like that. That's outside of a law enforcement. Yes, we're providing security, but it's not necessarily a law enforcement function. So that's an outside detail controlled by this. If it's a OUI roadblock, it's 4 hours at the overtime rate. So you got to look at the specific intent of the detail and then go from there. I haven't seen anything where we haven't been able to fill shifts and fill the outside details, so.
That was just my concern, that the on-the-road stuff was not gonna, would be,
That's a priority,
yeah.
so if we didn't fill the outside detail, then, in the past, we've talked about it. I don't know that we've ever gotten there, but for instance, Lake Region High School, we may not have been able to fill a basketball because of staffing, and we've called Bridgeton, and they've taken it, so. But the road really becomes the priority, number one. Number two, some of the reasons why we haven't applied for some traffic enforcement grants is because of the overtime. Somebody would rather have a 10-hour shift at overtime than a 4-hour shift going out and doing speed details and OUIs. And once they lock into the 4 hours, and then a 10-hour shift comes around, they're losing out financially. So we've had to kind of work with that as well.
Okay. That was my only concern.
Okay.
Yep.
So is it fine to take the 3 consent agenda items together?
There are 4.
This-
4? Oh, 4, sorry. Next page.
Oh,
Yes,
yeah.
sorry. Any further discussion on the consent agenda items? All those in favor?
Aye.
Aye. Opposed? Passes 5-0. ARPA business. Manager Gailey.
Thanks. First item under ARPA is a project that staff has been working on for a number of months, and it's finally come to fruition to bring it before the commissioners. And staff is very excited about working towards the Public Health Department's initiative with children preventative oral health infrastructure and the use of ARPA funds to get there. So I'd like to invite Public Health Director Liz up to the microphone to introduce this and introduce her guest this evening on this item. Thank you.
Hi, thank you all for having me today. I am here to just present a little bit about this project, and I also have Becca Matasovich here with me, who's the Executive Director of the Children's Oral Health Network of Maine, who she and I and a bunch of other folks have been working on figuring out how to address some of the problems that we identified during our county health improvement planning process. So I know you all have the memo in front of you. I just wanted to highlight a couple things for you as you're kind of making decisions around this item, and then also happy to answer any questions that you have related to the project. So as we shared with you in the memo, there are more than 30,000 children in Cumberland County who are currently getting no preventative oral health care. 2/3 of those 30,000 children have Maine care or no dental benefits. So 60% of children in Cumberland County with Maine care had no preventative oral health care in 2021, no preventative visits. And that's like the 12th. Cumberland County ranks 12th out of 16 counties for the percentage of children with Maine care who are receiving preventative services. So we've identified this pretty big gap for our children, and they're having preventative health care. COVID really only made all of that much worse. There was significantly less children with or without dental benefits had at least one preventative service since COVID. More children have gone without care. There have been workforce shortages. We've just seen that COVID really impacted children's ability to get those regular visits that are really needed. There's been long-standing barriers for children, especially children from families with low incomes and children in rural areas. And having this preventative oral health infrastructure was identified as a key priority in our county health improvement plan. There are also some opportunities that have come that we see as opportunities in the last couple of years. One of those is that Maine care reimbursements for preventative oral health care went up recently, and they're now closer to being adequate for preventative care. We have school districts who are really ready to be partners in providing and hosting preventative care in a school district on school property. The Children's Oral Health Network of Maine has been providing expertise and provides expertise across the state and support for these kind of oral health and infrastructure projects. And Becca has really been providing lots of support and expertise throughout the year to sort of figure out how can we best create a sustainable infrastructure here in Cumberland County. And there are some key dental providers that are really willing to expand their services, but do not yet have that kind of core infrastructure to have more patients. So with more infrastructure, they are more than willing to take on more Maine care patients. And there are particular dental health providers that are willing to do that. So we've outlined a 2-phase project, and the first phase really starts with mapping and modeling who's doing what where, and we have some numbers around where we think there are some pretty high needs, but really across the county, we see that there are many children without preventative care, and lots of schools who are willing partners but are not yet there yet on actually providing that care within the school. And there would also be work around expanding those school partnerships and coordinating with the oral health care providers how to then provide those services in schools or school-based health centers. And then the first phase would also pay for some funding for mobile equipment that could be used in the areas that are identified through the mapping and modeling project. So we have a couple organizations that are already providing services where they use mobile equipment with hygienists who go into the school and provide those oral health services. And then the second phase would be also working to expand those mobile equipment, but also working with partners to expand restorative services. So while we can create preventative services within schools, sometimes there are children, and now more children because of lack of care, who need restorative services. And those often have to be within a dentist's office. And so there's a need for more equipment if we were going to expand services. So the reason we're coming to you today for ARPA funds in particular is that the American Rescue Plan Act was really intended to address those existing systemic inequities that were really exacerbated by the pandemic. And in your efforts as commissioners to align with that objective, you've prioritized ARPA projects that support those who've been most impacted by the pandemic. And using that funds towards investment that rectify these health and educational and housing disparities that were really intensified by COVID. So this project really specifically targets those children who live in households at or below the federal poverty level. And it really focuses on creating infrastructure that once up and going is really there's sustainable funding through main care payments. There won't be a cliff at the end of 2026, and there will be thousands of children who have greater access to preventative oral health care, obviously leading to healthier kids and families and communities. So I welcome your questions around the specifics of the project, and I welcome Becca I know is happy to answer any questions specific to the work that she would be doing under this project.
Commissioner Mortonis. Excuse me.
Because I'm out in the world and out in the rural area, what is the dental care I would like out there now, or is in the schools?
So currently in the schools, there are some schools that are connected to the state school oral health program, and there are some that are connected to Mainly Teeth, which would be a partner in this project. And Mainly Teeth provides services, preventative oral health services they have a trailer, and they also go into schools and provide some services within schools, and they are connected to some of the school districts in the rural areas. Becca, perhaps you know exactly how many schools they're in right now. Do you mind coming up?
Yeah, sure. Mainly Teeth within Cumberland County is going to the Lakes region, to the elementary schools there, I believe, and Falmouth Elementary School, and then some or all of the schools in the Bonnie Eagle district, so a few of those are in Cumberland County, I think. The state oral health program, which provides more basic screenings and fluoride varnish, but not full preventive care, is in the Gray New Gloucester school district, the elementary schools, and the middle school there, and in the Portland, through Greater Portland Health and a partnership with Greater Portland Health, they're in the Portland schools and South Portland and Westbrook Elementary. So it's like a smattering, but different levels of service, and they're not necessarily coordinated with each other. And so that, I think, is part of the vision, is that we really need the screenings and the fluoride varnish everywhere. All schools, all kids need to have access to them, because we can't count on the traditional system being able to serve all kids. And then the kinds of advanced services that Mainly Teeth can provide kids might screen into them if they have decay already happening, or they need more advanced care coordination, then an organization like Greater Portland Health or Mainly Teeth could provide more advanced services and connections to restorative care. So right now, we have one or the other in some schools, and we really need both in all schools. And they need to be coordinated with each other, which takes some effort too.
It was in here that you will be working with the school, with nurses, and with the administration. That I know out in with the Lakes region, where that school nurse could be in multiple schools. So how is that gonna come in to this, where she might not be available, like in all the schools were to do all the coordination, and the administration, where everybody is so tapped out on staffing and stuff like that. Well, that's a real big concern, and I would hate to see, nothing go out that way, and that is all the resources, will stay here in town and in the city. And my other concern is, staffing of these people, because it's my understanding that it's very hard, to find hygienists today. There are job postings always everywhere. And there are, the agencies here in town, they don't even have enough of the hygienists, to do with their work. So what's gonna happen, like when this whole program, goes, and we can't get enough people after we spent, phase 1 and phase 2, well, but we can't hire anybody.
Yeah, so I'd say two things. So one is Lake Region is already a partner with Mainly Teeth, and it was already established that they are in partnership with them. And so this would give them ability to really expand what they're able to offer by having more mobile equipment and more folks to be able to do the job. I think part of the mapping and modeling project is really to identify where are the highest need places and where are there those schools that have that level of readiness, like those who are already doing it, like Lake Region and Bonnie Eagle and Gray New Gloucester. And then for us to say, great, that's where we are all gonna get on board as a coordinated system to really go to the places that have the highest need. Right now, it's sort of a smattering and a who says, yeah, me, which actually then starts to be less equal, right? We would like to say, where are there, do this mapping and modeling and say, where are the biggest needs? And then we're gonna provide those mobile equipment to meet that need. And so then I think what we'll actually see is a more coordinated and a targeted approach to where those services end up happening. And so I really feel like we're actually doing this infrastructure work is gonna allow us to ensure that we're actually reaching the more rural, more high-need places.
And the goal would be to get to all the schools.
Right.
So that we picture a big map on the wall with literally like numbers at each school, how many hygienist days are needed at each school. And it just might be that some are more ready sooner, some have higher urgent needs sooner, and trying to sort of, titrate the pace of the rollout, I think would be part of that, sort of figuring that out. But ultimately, the goal would be to be everywhere in all schools and to have a coordinated system that can then maintain itself, because there's a process for figuring out who's covering which schools. And one of the beautiful things about Mainly Teeth and organizations like that is they have they can have a very flexible staffing structure, because they can take a part-time hygienist who might work in a private office 4 days a week but have 1 day a week where they want to spend some time going into schools, and so they can take on sort of per diem, and also they work with UNE and take hygiene students and dental students out, so they can sort of capitalize on more flexible staffing structures. And some people are really excited to get into schools and get out of an office too, so.
How many schools are there in Cumberland County?
Well, there are about 90 schools that are counted as public schools. And currently about 40% of them, I can tell you the exact number of schools, but about 40% of the enrollment base of those 90 schools has either access to the school oral health program or mainly teeth, but not both, and then 60% don't have access to either right now.
So this isn't going to go into the private schools at all?
I'm not, I wouldn't say that it isn't an option. I think I think the push needs to be on getting into public schools, and getting everywhere. And if there are private schools who want to be part of it, I don't think that would be ruled out. But it might be more up to them to, say they want to participate.
That's all I have, Mr. Chair.
Any other questions? Commissioner Gordon?
Yeah, I take it from the way you're talking that is this really more of a rural program? Or where do you envision the majority of the assistance is required?
I would say there are some preventative services. There is, I guess it's both. I would say it's really gonna be both. I think on the front end, there are, Greater Portland Health is providing services already in Portland, Westbrook, and South Portland. So they may be a part of some of the expansion that happens, perhaps into other areas. I foresee them really moving into other areas. They are really already doing a lot of the work in Cumberland, in Greater Portland area. And so it is really to really work on those, with those other schools who are not being covered by Greater Portland Health already, and maybe have minimal work that they're already doing with mainly teeth, to make sure we're expanding those services to everywhere.
Now, this program that you're talking about, or we're talking about developing here and getting underway, is it just from the opera funds of the county, or is there additional assistance that you're getting from the state and municipalities, and if so, how much?
Yeah, we are hoping to do, there are a lot of efforts that are happening, and we are trying to use some of the efforts that are happening to synergistically do some of this work. So the state is funding, they fund the oral health, a school oral health program. They've also funded a local organization called the Oral Health Equity Collaborative that is doing some work around ensuring that people who are Black, Indigenous, and people of color have better access, better oral health outcomes. So we're on, both of us are actually on their local committee for that. And then also I'll let you speak of some of the work. Community, or the Children's Oral Health Network of Maine is being funded to do a whole bunch of infrastructure projects across Maine. And we feel like having their expertise, we're gaining a lot of the expertise that they're doing across the state to use that in our project here in Cumberland County. So perhaps you can speak a little bit to that.
Yeah, the Children's Oral Health Network is funded by philanthropic dollars. So that's why we can partner sort of in an in-kind way to support this work, because we've got the funding for our staffing and our core operations. We also have a couple of grants that are sort of would be connected and would help buttress this effort. So one is from the Department of Labor, working on a workforce initiative to try to grow the oral health, public health workforce. That's a statewide effort. And another statewide effort, which is developing a model called the Virtual Dental Home that allows for more teledentistry connections. Right now that is focused in Head Start programs and early childhood programs, and Cumberland County is one of the participating counties there, with mainly teeth and Greater Portland Health as partners. So there's funding sort of flowing to those partners from those different angles as well, which is partly why this project can be such a narrow sort of infusion of some of the infrastructure work that's needed specific to the schools within this context, in which we're working on some of the other areas of work around it. It's kind of a unique opportunity.
And I would also say part of what we're hoping to do is really build out this infrastructure that then is sustainable through main care payments for the actual services. So it's really to build out that infrastructure that then allows folks to actually be able to provide the services. that then we don't have to pay for.
Last question, or not question, just a comment. Just to reiterate, I was very interested in that you thought that by the end of 2026, the county would be out of supporting this program.
I think that we won't need ARPA funds at this point, at that point, to support the program. We may think about how have we built out capacity? Do we need to have additional, is it me just connecting with the folks doing some of the coordination work, or do we have to build out, ask for find other funding out in the world through grants to support it? Or is it that I think we will be close to having built out a very solid infrastructure where we won't obviously need other county funds to do the work, to support the work.
Thank you. Thank you, Mr.
Any other questions?
I have
Patty?
questions and comments. Just writing off that last comment around 2026, where you feel like you'll have a robust infrastructure in place. I'm sure it's too early to tell now, but what I'm hearing is you have 40% of those public schools currently supplying some types of services. By the end of that 2026, have you set a goal yet of what that percentage would increase to for us to follow along on that progress, so we'd understand the impact of these funds?
Yeah.
I mean, the goal is 100%. I think the barriers that might get in the way of reaching that 100% will be not the funding barriers, but the workforce. There may be things that slow down that target, which would be primarily workforce, and if there are schools that just aren't ready yet. But if everybody's ready, then I think the workforce ones they may take a little while to resolve, but I think we'll be able to work around it. There may be some, some time period where maybe for a couple of years it's visiting 1 time a year instead of 2 times a year and working up. But the goal is 100%.
Okay.
I will say, no county in the state has tried this yet. This would put Cumberland County, potentially like leaping from sort of 12th out of 16th to potentially the front of the pack, and I'm really excited about that. That's part of the reason why we're investing so much in supporting this effort too, because we really think this could set a model for other counties to follow as well. But Cumberland County is the biggest county and has the most schools, so it is ambitious.
I just have the last comment. I just want to say, I think that having a mapping model is important to really assess the needs and find out where the gaps are to create some of those goals. I just also want to comment on infrastructure in terms of partnering with schools and how important that is. When I think about all of the unhoused youth, teenagers, folks who you really kind of can't keep track of data-wise, that if you look at the numbers you just gave us, then we think about that population that is truly underserved. Partnering with schools is going to be critical to find those folks who are unhoused and get them these kind of preventative and potentially restorative care to that population. So I'd be curious down the road, not tonight, of course, but just to keep that in the back of your mind of that whole population and how they could be best served. Thank you.
That is
Commissioner
a great
Cludier?
point.
Oh, I'm sorry, go ahead.
I don't have a question. My comment is that I was glad to hear that you're coordinating with the UNE dental programs. I, of course, 100% support the need to kind of penetrate unserved rural areas, but this is also something that's very important for Portland, because it's an unfortunate fact that the main care population in Portland is very large.
Yes, it is.
Did you have anything else, Sue?
I have a question for you, Jim and Alex. If at the end of 26, how would that, if they still need money, how is that going to go into the budget? I mean, have you thought about that?
I think
Because I know it was opera funds at that point.
Right, and I think Liz had made mention to it in her presentation, and that first area to review is what grants are out there.
Right.
State, federal, maybe foundation grants. I think this is a pretty worthwhile and a fundable project that we're providing some early seed money to create the infrastructure. to get the feet underneath, but if it needs more money, that's the next step, is looking for outside money, not looking towards the tax rate to put this on.
Any other follow-up questions from commissioners or comments?
Move passage.
Any further discussion on the matter before the board? All those in favor, aye.
Aye.
Opposed, nay. Carries 5-0. Thank you, Liz. Thank you both for your presentation
Thank you very
today.
much. Yeah.
Our next item is adoption of the amended ARPA budget for project funding.
Thank you. I'm going to invite Sandy up to the mic, but while she's working her way to the mic, I'm just going to introduce this and say that staff have been working, primarily Sandy has been working to really fine-tune and allocate the county's opera funds. There has been a lot of conversation down in Washington that there may be a clawback, or at least one party is looking to claw back unused COVID funds. And as the staff have over the last year and a half, given you periodic updates to the allocations of the opera funds in the spreadsheet that you've seen a couple of times. This is an attempt for us to bring forward a spreadsheet that really allocates all the funds. Have zero balance. Everything's been allocated. So now that I've taken the thunder out of Sandy's presentation, I'll pass that over to Sandy.
Nothing new, Jim. Thank you anyway, nonetheless. But Jim, to emphasize on what Jim was stating, there are rumors and proposals out there to rescind unobligated, I should say, ARPA dollars. And so we should really be looking at this and taking this as an opportunity for us to highlight how well we've done spending our ARPA dollars. And really emphasizing the stewardship of the county commissioners on prioritizing spending those dollars, and then also laying out a path and creating a foundation for us to use so that people can access it quickly and effectively, and we can spend it within our community. So this budget before you just outlines all of the wonderful projects and programs you've already selected, highlights a few new ones for us just so we can obligate those funds and show them as being committed to the Treasury Department if that's something they're going to try to ask us for. So I'm willing to take any questions or comments on that.
Questions for Sandy? Go ahead, Commissioner Coolier.
I just want to say I think it's a good idea to be doing this, and the sooner the better.
Thank you for the spreadsheet. It looks amazing. I just want to say thank my fellow commissioners who I haven't worked with that long. All the work that's been done, it's really impressive. When you look at the spreadsheet, all the groups that you've worked with and just keeping track of all those funding. I came in late to the game, obviously, but I just think it's really impressive. I want to thank my co-commissioners because it's some really impressive work. Thank you.
And I would just offer supportive comments to Sandy and to everyone that was involved in this project, because to the executive staff, this is a once-in-a-generation opportunity that we've had in Cumberland County, and to put it into play the way you have, and to finish it with the funds that were available, and to allocate the funds before they are clawed back or accredited as something else is speaks volumes for everyone that was involved in the project, and will make a difference in the residents of Cumberland County citizens for not just the immediate future, but hopefully for another generation. So thank you very much.
Thank you.
I'll move passage.
Second.
Any further discussion? It's been moved and second. All those in favor? Aye.
Aye.
Opposed? Nay? Motion carries.
Thank you.
Thank you, Sandy. The agenda. Oh, you got everything. Next, new businesses. Is that it, right? Yeah. New business, item 23037, adoption of the Cumberland County's analysis of impediments to fair housing studies. Manager Gailey, sorry. Do you want to be a commissioner tonight?
Thank you. I won't, I've learned my lesson on the previous project, so I'm just going to pass this one off to Kristen, the CDBG director.
Thank you. Kristen Stiles, Community Development Director. We're here for the analysis of impediments to fair housing. The Fair Housing Act of 1968 requires that HUD administer the programs in a manner that affirmatively furthers policies of fair housing in the Fair Housing Act. And as a recipient of HUD funds, we need to demonstrate to HUD that we are also affirmatively furthering fair housing. The easiest way to do that is to do a study every couple of years and examine what our policies are. So to do this study, the best way to do it is to hire a consultant that specializes in doing affirmatively furthering fair housing policies. And when we went to do this, we put out an RFP and looked at several different firms. We interviewed a couple of them, and we ended up with Root Policy Research. Part of why we chose to go with Root Policy Research is because they helped write HUD's policy. So that makes it nice and easy. They also did all of the training for the HUD staff on how to look at these reports and make sure that they're done the right way. And the best part, one of the people who helped work on this is from Raymond, has lived in Raymond, her family still lives in Raymond, and her sister lives here in Portland. So even in the interview process, she was aware of what our housing situation here in Cumberland County is like, and what our situation is with people from outside moving into Cumberland County and the pressure that's causing on a lot of our towns. So Root Policy Research conducted a bunch of one-on-one stakeholder meetings. Excuse me, I'm not sure why my voice is cracking so much. One-on-one policy stakeholder meetings. They did focus groups with various stakeholders around the area, including developers, people with lived experience, town officials, and then they also did a survey of over 750 people to kind of get a full picture of what residents felt the housing situation was. In addition to that, they looked at the demographic patterns. They did access to opportunities, disproportionate housing needs, the fair housing environment, including laws and the enforcement of fair housing laws here in Cumberland County, complaint trends that groups like Pine Tree Legal are seeing in terms of fair housing, what fair housing resources are available, and finally, the zoning and land use that's happening within our various towns and cities. So with this study, they worked with the town planning offices in all 27 towns and cities in Cumberland County to write this plan, and as well as look at all of the new legislation that's been happening. In this report, it's often seen as a bad report card because the whole point of it is to point out what our flaws are and to tell us that what we're doing wrong in order to fix it. But what I was really surprised about was when we were working with the towns, how many people thanked us for this and how many town officials pointed out how helpful this will be in helping them change their policies to make it a more fair housing situation for everyone that lives here in Cumberland County. A couple of the big takeaways from this report, the full report is 332 pages, and the executive summary, so that's why I only included the executive summary for you all, is a pretty easy read. It's impossible to summarize all of it because housing is such a complex issue, but a couple of the big takeaways that I thought were interesting to point out are they're not necessarily directly housing. Public transportation is a huge one in creating fair housing here in Cumberland County. We really need to be looking at our transportation system outside of the greater Portland area, and that is going to help with creating a more equitable housing situation. The other one is public infrastructure. When we're looking at housing rules, a lot of the reasons why towns have large lot sizes is because they don't have the public infrastructure underneath to then say you can go and build 60 units on this plot of land when you don't have the public infrastructure to support it. Looking at it from those angles are ways that we can tie in our HUD dollars that we're already receiving to say with our CDBG money, we can put in that public infrastructure, we can put in the sidewalks, we can put in the sewers and the roads, and then with our home dollars, then we can come and help build some more affordable housing. We can also use this to help create policies within our towns that make it more equitable and easy for us to do that and build that type of housing. Some of the other issues that have been pointed out are a lot harder for us to fix, such as discriminating against Section 8 voucher holders. Those are things that we need to be aware of and help point out and change It's just not as easy of a task to do. So they created a nice matrix for us of kind of different action steps that we can take, as well as action steps that each of the towns and cities can take to make their local policies more affirmatively furthering fair housing friendly. And I'm happy to take any questions.
Any questions from the commissioners? Or staff? Seeing none, call for, I need a motion.
Actually, I'm sorry, real quick. This item and the next item both require a public hearing. I don't know if you want to do a public hearing on each one or do it,
Should do it each one.
Each separate one,
Okay.
right. So are there any comments from the public or any other comments regarding the adoption of Cumberland County's analysis of the fair housing study that was done?
Was this advertised as a public hearing?
yes.
It's on the new business on the agenda.
And it was advertised in the Portland Press Herald as a public hearing and a public comment period until May 21st, I believe, for this one.
So is our motion tonight just to defer this to the 21st?
No,
We're
just to have,
adopting.
just in case anyone wants to comment on it after that time
After
period.
the fact?
Yeah.
Move passage.
It's been moved and seconded. Do we have any further discussion on the issue before the board?
No, I was thought you were looking for a vote, sorry.
Yes.
I was just going to
Commissioner
say,
Cloutier.
I was impressed with the strategy that would tie other funding sources for infrastructure with policy changes that would encourage workforce and low-income housing. I mean, I think if the offer is, we'll build you a sewer and we'll help you build some houses afterwards, but we need to have a policy that shows this as a local commitment. I think that's good. That's a good approach.
Yes, Commissioner Gordon.
Yeah, I think your comments on transportation are spot on.
Yeah.
How that can get accomplished is going to be vital to this county.
It is, it really is. It's something that keeps coming up. It came up in the CHIP from Liz's Public Health Department and Transportation. It's an issue that we need to focus more on, for sure.
Any other questions or comments from the commissioners? Seeing none, call the vote. All those in favor of adopting the
Aye.
policy? Opposed, nay. Passes 5-0. Kristen, thank you.
Thank you.
And item 23038, the second reading and adoption of the Cumberland County Annual Action Plan, CDBG. Manager Gailey, any comments?
This item is something that you see every year. First reading was done in April, second reading is this evening, and then it quickly gets shipped down to Manchester, New Hampshire for review, probably tomorrow. But it is an outline of how the county's going to spend their CDBG and home funds for the coming year. Kristen's here to answer any questions that the commissioners may have on this item.
I noticed that I think I attached it to April's, but I forgot to attach it to the second reading tonight of just a list of everything that we're funding with the CDBG dollars this year. Nothing has changed between last meeting and this meeting. I'd be happy to answer any questions or go over it
Commissioner
again if you
Cloutier?
would like.
We have to convene another one of those extensive public hearings?
Yes.
Yes, we do. Are there any comments from the public or any comments from the commissioners about the CDBG proposed action plan and budget for 2023? Seeing none,
I'll move passage.
Second.
it's been moved and seconded. Any comments and further discussion by the Board of Commissioners? Call the vote. All those in favor, aye.
Aye.
Opposed, nay. Kristen, you have a budget, passes 5-0.
Great, thank you so much.
Thank you for all your hard work in this area. Next action item, 23030, approval of the county treasurer's award for a winning bid of the tax anticipation note. Alex?
Yeah, so we got the results back a little over a week ago on the tax anticipation note, which was down to that 7.5 million, and as sort of we'd expected, the interest rate was considerably higher than prior years. That 3.38% would have been quite brutal a few years ago when we were going for a larger number for a longer duration. So fortunately, by virtue of us lowering the number and in particular shortening the duration, that helped keep this under budget. And Piper Sandler won the bid.
Any questions by the commissioners?
Move passage.
Second.
I have a question.
Yes.
What's the duration of the bond?
This one will be May, June, July, August. So it's going to be about 5.5 months. That compares to about 10 months as recently as 5 or 6 years ago.
Any further questions? Call a vote. All those in favor, aye.
Aye.
Opposed, nay. Item carries 5-0. Next item on the agenda. Item 23039, Manager Gailey.
Thank you. This item's coming forward this evening for the Commissioner's review and hopefully acceptance. It is a contract between Cumberland County Government and the Summerall Group of Washington, D.C. It is for consulting services to represent the county on behalf, in front of the U.S. Marshal Service, to, one, determine an appropriate per diem rate for federal inmates at the county jail, and to negotiate with the Marshal Service to see what type of rate we can get moving forward. As the commissioners are aware, we are at $130 per night per federal inmate that we house, and with that amount being last posted in, I believe it was 2010, 2011, we felt it was time to revisit on top of additional requirements that the Marshal Service is asking of the jail for services to be provided to federal inmates upon return to the Cumberland County Jail. So this is a lot of legwork. Really, this is a sole source bid. This person or this group is really the only ones around that I could find that does this type of work. And we worked with Joe Summerall back in 2010 when we last set this, so he's no stranger to Cumberland County. With that said, I'd ask for approval of this contract of $52,000. I think. My computer's frozen.
52.5.
Is it
Right.
52.5?
Yeah.
I thought it was something, $52,500. And just to give you a little context, back in 2010, it was $75,000. So it's actually gone down. So that's a positive when we were all thinking it was going to go up. I do know that we have the jail major and the sheriff here this evening. If it's okay, Mr. Chair, if I'd like to invite either one of them up for any comments or.
I'll keep my comment brief, and then I'll kick it to the major. I support this. I think it's important that we negotiate a contract that's in the 2023 era and not in the 2010 era, especially with all that they expect out of us. Major, you?
Again, I agree with the manager and the sheriff in regards to retrieving these services. Again, they have a better gauge on what the current rates are and the impact. Again, they're just looking for long-term offender programs and accommodations, and there's a cost with that. So again, I think having this vendor is a better option to gauge a proper per diem rate.
Thank you.
Major. So we'd ask for approval by the commissioners. Thank you.
Yeah, Commissioner Gordon has a question.
Yeah, before you go away.
Oh, sorry.
For us to be able to take advantage of this, Sheriff, you got any idea how many more people or correction officers you're gonna have to bring on board?
Initially, they're only talking about a handful of inmates. Initially, after 6 months, they're talking about possibly a unit of 43. If we go to a unit with 43, we're probably looking at least 15 to 17 staff to make that work. The initial, we can make it work, single digits, but once we get up to 43, that's when we're gonna have some challenges.
And just to give you an update, I was gonna do this during the comments, but right now we have 5 in the academy. We have 5 scheduled for the next academy. We're waiting to see when that is. We may have to do our own. And we have 3 others that are looking good. They're in the medical era of the hiring process, 2 of which are certified. So that's 13 people in the pipeline tonight, as I stand here.
The certified individuals won't have to complete the academy, is that correct?
1 is Maine certified, so he won't. The other is Florida certified, and it won't be a full academy. It'll be probably, much like law enforcement, maybe a week or 2 of certain classes and then testing out. So that's still better than sending somebody to the academy cold, so.
Very good. Thanks, Sheriff. Steve?
As these people come on, Sheriff, are we opening up the jail, or is that?
The intake will open up next Monday, fully to all arrests. But, again, as people come on, we want to get them trained. So we're hoping that we can keep the numbers a little low still until we can get these guys up and running. Because that's 11 people that are really, really new. So I'm not in a real big hurry. Let's get their feet under them first. Because it can be overwhelming. I was talking to some corrections officers today, and they were saying some of the younger people, they're doing a good job, but it's a bit overwhelming. Because they come in with this aura, that was an opinion of a corrections officer, that you got to be big and tough. And the new corrections is basically talking to people and stuff. So they're really finding themselves. But the answer is, we'll open up intake, which has long been coming, on Monday the 18th at noontime. And then as we open up and get more people, slowly start opening the doors.
Yes, Commissioner Cludier.
I assume someday we'd have to talk about this. I was kind of surprised that with the announcement that you're opening the intake again, I assume to misdemeanors, as well as anything else, if you're being asked to incarcerate somebody. What's the arrangement with bail commissioners to serve anyone who happens to be dragged in there for reasons they don't think are justified or which wouldn't justify incarceration? How quickly can people be processed through a bail commissioner?
It depends on the availability. About a month ago, the major and I met with some of the trial judges. They were asking what our authority was to shut down the jail intake area. And I said, honestly, I'm not sure I have the authority, but I have
can
the
help them with
obligation.
that, I think. Yeah, I think, certainly the commissioners would support that, so I think they would anyway.
Yeah, I told them I have the obligation to run a safe and secure jail. And that's what I lean my hat on. They were good about it, but they had some concerns about various cases that, if an officer let them go, bad things could happen. What we also found out is some of the arrests that officers weren't able to bring in, they were calling up justice of the peace in the middle of the night and getting warrants. And then once they had a warrant, they brought them in because we were accepting all warrants. So that was costing the state some money as well. And then the last thing that was really concerning the bail commissioners is that if you had somebody that had a pattern of criminal conduct and the police officer brought them to the station and asked for a bail commissioner to set bail, if the bail commissioner didn't want to set bail or set bail and wanted the person locked up until they could make the bail. They felt that they were out of control, out of options, and quite frankly, maybe putting themselves at risk. So this decision not only affected police officers, but it affected bail commissioners and stuff like that. So, you know, when I shut down intake in August, late August, it was because I was over there and I saw a number of employees walking around like zombies. And I felt like I had to give them a break, and then it just never got better. We're getting better. Timing is all about, you know, I want to be open for the summer. And it's not great, but we're a little bit better than we were last year. And that played into that decision. So hopefully I answered your question. And as soon as the bail commissioners can come in and write the bail and get the person out, I don't think that's going to be an issue. Really, I think the things that we're going to have a little difficult on is those arrests that come in for obstructing a public way, urinating in public. They're brought in on a Friday night because they're creating a real pain in the neck for people in Bayside, the Portland Police Department and stuff. That may be our Achilles heel in that they get booked on a Friday night and they're released with time served on a Monday. That's a problem. I think those cases were the ones that we've been missing for the last 8 or 9 months. Most of the other cases are probably going to be a quick turnaround. And like I said, domestic violence ones, you know, there's no wiggle room anyway.
Any other questions for the sheriff? Thank you, Kevin.
Yeah.
I just have a comment.
Yes, go ahead.
My comment
Patty.
is just, I want to appreciate that the county manager is using that sole source. Apparently, there's not many other folks to do this, but I think this is a good example of going to an expert to get the information we need to get it right, because this is an important per diem to figure out in the year 2023, whether it's hiring practices or looking for experts. You know, we need to be working in the 2026 timeframe of what we're doing and how we're tackling problems. So I'm in full support of this. Thank you.
Yes, Commissioner Cloutier.
I'll say when I saw in the memo that it was like $55,000 instead of what it was 10 years ago or 12 years ago, I assumed that was a typo, and that must have been,
I read it twice.
yeah. I guess that's the,
That's the good news.
that might be the effects of data processing and availability of data and that kind of thing, I suppose. That would be, whatever the result is, probably would be a good little memo to send to the Department of Corrections for them to understand what it actually costs to run a jail.
Yes, Commissioner Gordon.
To that, to your comment, Commissioner, the professional counsel for jails is going to take that issue up as soon as this study comes back.
Good.
Call the question? We've already moved and seconded, have we not? All those,
I'll do it again
Okay.
if I was the one that did it, but.
Oh,
I think
Catherine,
we
do you have a motion and a second?
I don't think so. I don't think so.
okay.
I move passage.
Do we have a second? Second. Any further discussion? All those in favor? Aye.
Aye.
Opposed, nay. Matter carries 5-0. Next item is 23040, and Manager Gailey, again.
Thank you. This is seeking authorization for myself to enter in an agreement with Developers Collaborative for preliminary design work on the administrative building down on the backside of the jail LEC campus. Through the work that staff has done with the medical wing to the jail, or the new medical wing, I should say, to the jail, and what we've learned through the geotechnical studies and the soil contamination studies that we knew that were down there, we opted to look at those two items over in the administrative pad closer to the parkway, and we found very similar type of soil and geotechnical readings. We huddled as a group, staff-wise, and also brought in Kevin Bunker and his crew to talk this over. And we feel as though it's in the best interest to really have a gauge on what next steps are. And to do that, we need to spend a little money, which we had talked about when the commissioners had originally awarded the contract to Developers Collaborative, and that is just to do this preliminary design, to take a look at what type of foundation, what type of soil removal. Are we gonna be going with pylons, and what does that look like? It really will give us a ballpark price on what we're looking for a building to meet the county's needs before we go too far. So it's a I wouldn't say a little bit of money, but it's some money to get us to answering the next questions. And those next questions will dictate whether we have a green light or a red light moving forward. So we're feeling optimistic. The Developers Collaborative is feeling optimistic, and we're feeling as though this is our next step in the long process that we've been going through for this building. So I'd ask for the commissioners to authorize the county manager to sign the agreement with Developers Collaborative in roughly the amount of $63,250.
So moved.
Do I have a second?
Yes.
Oh,
Second.
sorry. I hadn't heard anyone. Moved and seconded. Any further discussion? Yes, Commissioner Gordon.
Jim, with regards to this study, and I guess the thing for me that's holding it together is the idea of developing a campus. How is, and maybe you haven't explored that yet, but how is this going to impact our decision? I mean, if it becomes more expensive than we want, are you considering moving a campus in a different place?
I think we need to talk about that, because the whole intent was to downsize the number of campuses that we have, because I think we're very siloed, and to bring more in-house and on single campuses, or at least 3 campuses, versus the 5 that we have today. You know, I'm staying optimistic. I think through the engineers that Developers Collaborative have, they can figure best ways of moving forward. Yes, I think the barometer is gonna be cost. Does it tip that level for us to pay some upfront, and then what's it look like over a 20-25-year lease payment? We also have to have a keen eye on total cost. We just can't have unlimited checkbook here.
Well, that, and you've got to think about what's your next step, the next structure you may have to build in that area.
Well, I think we'd be pretty much tapped out by then. I think this would, anything that would go there, even though it's a very small footprint for the building, I think logistically, it would be tapped out of that complex.
Commissioner Smith.
Yes, thank you. You know, unfortunately, we need to do the work and do the due diligence, it's clear. I guess my question, through this scope of work, it mentions whether we would be brownfield eligible potentially, or, you know, what will tip the hat, and what is the probability of us receiving brownfield funding if that is in fact the case?
The consultants felt as though that it was a clear possibility. They were going to look into it as part of this
Okay.
process. There are 3 pots of brownfield money out there. The city of Portland has a pot, GP Cog has a pot, and I think it's the state of Maine has the 3rd pot. So 1 of 3, 2 of 3, all 3 of 3
Yeah.
can be explored.
Okay, that might be the offset we're looking for, maybe?
Correct.
Okay, great, thank you.
Commissioner Cloutier.
I was just gonna say, this is an old story as far as I'm concerned. If you're not on Munjoy Hill or Bramhall Hill, and you're somewhere near the Atlantic Ocean in Portland, this is a familiar story. It's a lot of, we already have documentation that the overlay here is marine clay. That's very common. Usually the dire pollution doesn't get very far into marine clay, and so I share the optimistic idea. We went through that several times in Portland, sometimes we bought land for cheap in the blind because we knew it wasn't gonna be very much. The people at Public Works were very confident most of the time, and they were mostly right. So, I think it's got a good chance, and probably, that campus can't be touched without dealing with these kind of issues. And the more possibly difficult situation is the need to support a building with piles. And I can remember several times when, if you sat in Monument Square during the business day or any other time of the day, you listened to pounding and pounding as piles were being driven 60 to 80 feet into the clay, so that you could get an adequate foundation support. So, but that was for a 12-story building, so we haven't gotten to the 12-story decision line yet, so we should be all right on that. All from the 12th story, you probably get a pretty good look at Portugal.
Any further comments or questions? We need a motion.
Move passage.
I'll second.
Any further discussion? All those in favor, aye.
Aye.
Opposed, nay. Matter carries 5-0. And good luck, Jim. We share your optimism, and hopefully we'll have some good answers come from that. Next 3 matters, we have proclamations, 23041, 42, and 43. So, do you want to handle those, Jim, or do you want me to go for it?
Sure. This first one is a proclamation on Child Care Providers Day, or Child Care Aware of America Day on May 12th, 2023. This was someone from outside the organization reached out to Catherine in our office and asked whether the commissioners would be willing to recognize this day through a proclamation, and hence it's on your agenda this evening. I think there's a lot of conversations most recently because the state legislature is bringing up a number of bills around child cares and how to increase capacity statewide around child cares. And so there's and we've made an emphasis within the use of our ARPA funds for child care facility capacity. We've even gone and explored creating our own child care with the city of Portland, trying to provide affordable child care to our employees. Unfortunately, that really never got off the ground, but it's one that we are constantly looking at as a benefit to the employees. So this proclamation is just recognizing the Child Care Aware of America Day of May 12th, 2023. Thank you.
Need a
Keep
motion?
on.
Second?
I'll second.
Do we have any further discussion on the proclamation for Child Care Providers Week? Seeing none, all those in favor, aye?
Aye.
Opposed, nay? Matter carries 5-0, and we're very pleased and happy to support proclamation. Next proclamation, National Correction Officers Week.
Can
All
I
right.
ask the question, or do we have anything we're planned? Are we doing anything?
Yes.
Because I know in the past, we've had
Yeah, so we
cookouts.
have events all week for the staff.
Could you send us those?
Sure.
In the event that we want to attend or anything?
Absolutely. There's a award ceremony for certain correction staff on Thursday, but I will send you
Okay.
itinerary.
Thank you.
Would you like me to read this? I probably should have read the other one.
Yeah, please.
I can read this. Whereas correction officers and trained law enforcement professionals dedicated to maintaining safe correctional facilities and ensuring the public safety, and whereas correctional facilities across the United States are run by highly qualified and experienced individuals with a deep understanding of the challenges within the profession, and whereas correctional officers and employees are responsible for the custody, care, and rehabilitation of thousands of offenders each year, or every year, as well as the maintenance of safe and secure facilities, and whereas correctional officers and employees are resourceful, capable, committed, patient, and persistent professionals in criminal justice. And whereas correctional officers and employees are admirably in many different capacities, including jail administrators, chaplains, nurses, supervisors, social workers, teachers, managers, and directors. And whereas correctional officers and employees mentor, counsel, and treat offenders. And whereas correctional officers and employees provide offenders with direction while assisting with reentry and life outside corrections. And whereas correctional officers and employees rise to meet a challenge and serve this honorable profession nobly and admirably. And whereas the dedicated men and women of Cumberland County Jail have displayed a high level of commitment and dedication to the county and its inmates over the last year, assuming new and greater responsibilities, taking on additional shifts all during a time that the pandemic has resulted in decreased staffing levels. And now, there and before it resolved, the county commissioners of the Cumberland County declares the week of May 7, 2023 to the National Corrections Officer Week in Cumberland County, Maine, in honor of the men and women who deserve recognition for their service and exceptional performance of their duties under difficult circumstances.
Move passage.
I'll second.
Moved in seconded. Any questions or further items to discussion on this matter? Seeing none, call the vote. All those in favor, aye.
Aye.
Opposed, nay. Matter carries 5-0. And item 23043, proclamation for the May Law Enforcement Week. There's someone else other than?
I got it.
Oh, okay.
That's why I brought some water.
Yeah.
To recognize National Law Enforcement Week of 2023 and to honor the service and sacrifice of those law enforcement officers who protect our communities and safeguarding our democracy. Whereas there are more than 800,000 law enforcement officers serving in communities across the United States, including the dedicated members of the Cumberland County Sheriff's Department. Whereas across the country, citizens take the lead to demonstrate support of National Law Enforcement Week. Whereas law enforcement officers of every rank and file have chosen a profession that puts their life on the line every day for their communities/counties. They answer the call to the public service that is demanding and often unappreciated. Our National Law Enforcement Week, we have an opportunity to thank them for their service. Whereas the Cumberland County Sheriff's Department has been accredited since 2015 and most recently received the Triple Crown Award from the National Sheriff's Office Association for being nationally accredited in law enforcement, corrections, and inmate health care. And whereas 73 dedicated men and women make up the Sheriff's Department, giving their service to the citizens of Cumberland County 24 hours a day, 365 days a year. Whereas a total of 33,746 calls for service were responded to during 2022, calls ranging from routine traffic stops, criminal mischief, domestic violence altercations, drug overdose, and attempted murder, among many others. Whereas the Cumberland County Sheriff's Department goes to great efforts to be a community partner by offering services like National Drug Take-Back Day, National Night Out, Consumer Fraud Awareness, Senior Awareness Programs, and Coffee with a Cop. Therefore, be it resolved that the Cumberland County Commissioners will observe May 14th through 20th, 2023 as National Law Enforcement Week in Cumberland County and publicly salutes the 73 members of the Cumberland County Sheriff's Department and thanks them for all they do for public safety in Cumberland County.
Thank you, Jim.
Move passage.
Second.
Moved in second. Any further discussion or comments? Seeing none, all those in favor? Aye. Opposed, nay.
Kevin, do we have anything planned, for law?
No.
Enforcement, okay.
Next item, comments from the county manager. Jim.
Just two comments. Just a reminder, next week, next Tuesday night, the 16th, the commissioners will meet up with the department heads over at the Cross Insurance Arena, and we will work through a goal-setting exercise that we typically do every 3 to 4 years. We've gone a little bit long this past time because of COVID, but we're regrouping here next week and working through a very important exercise, I see. Just a reminder, the commissioners as well as department heads have homework in anticipation of that meeting. And that homework is due Thursday of this week. So clock's ticking, people. And so that homework will be all tabulated into a document and sent out on Friday to everyone so that you have time to read it before next week's event. And then the only other item I have is a reminder that on May 22nd, we have a workshop. That workshop will have 2 items on it at this time. The first will be the discussion of the jail budget. And then the second is, as the commissioners are aware, we do have another request for use of the Community Corrections Building. And so that item will be on that evening also. So right now, it's a 2-agenda item, and I think those 2 items are enough for that evening at this point. Thank you.
Alex?
Just wanted to mention, sort of, we're already 2/3 of the way through our weird 6-month budget. I'm already getting increasingly calls from various department heads asking about what's left, which sort of fries the circuits a little bit. So far, so good. The comment I'd made earlier that, the days when the deeds was going like wildfire has come to a close. That has stopped, but because we ratcheted down that budget, looks like we were prepared for that. So I don't expect any big moves one way or the other on this 6 months budget, which is also to be expected because we really stripped out just about everything. It really should have done that, and so far, so good.
Thank you. Travis?
I want to ask, sure,
sorry.
Alex, a question, excuse me. Alex, you said that the amount of revenue coming out of deeds is diminished.
Yes.
Is interesting comment. If you look at what's going on in the state, they have passed a bill for homelessness to be supported by the funding that the state gets, half the funding that the state gets from that area. And I'm sure that their prediction is probably flat. It doesn't show the dip.
Yeah, and a great deal of what we collect at deeds goes straight to the state. In fact, almost all of it.
Yeah.
What we talk about as our revenue is really only a tiny fraction of the amount that goes up to them. So, yeah, that would be pretty good-sized dollars, statewide in particular.
Any other questions for Travis? I mean, for Alex? Travis?
Well, Commissioner Gordon, it's up to you. I'm happy to give a summary of
No, go
what's
ahead.
happening in Augusta, but Commissioner Gordon is doing a fantastic job at the Legislative Policy Committee. They're in the home stretch now. It's the last month or so, and one of the things that we start to see at this point is all of the items that are going to start being kicked to next year. We've seen a few items that are relevant and important to county governments that have already been extended to the next legislative session. One of them, I know that this is a big topic for sheriff departments, is a rural patrol bill. And another one that has relevance to us is additional funding for EMS. I'm actually happy that that bill is being kicked to next year because it will give us some time to work with our contractor on the regional study and then go advocate maybe specifically for certain categories that would be worthy of additional funding, not just distributing money to towns and saying, here's, save the day. I think we'll be able to go back with some solid recommendations of things that would be worth investing in. And then, of course, the budget. We understand the governor is going to submit a change package because of the latest good news in revenue. The counties are asking for another roughly $7.7 million in jail funding. Historically, the state has funded roughly 20%. Cost to operate jails has gone up quite a bit, but the state currently is flat funding us from the last legislative biennium, so the hope is that we'll be able to get something in the range of another $7.7 million distributed statewide to counties for jail operations. Otherwise, I mentioned the EMS study. We're calling in all of the towns to complete their materials by next week, and I think that Dynamics will be up visiting maybe as soon as next month to do some on-the-ground work and hopefully start to turn out some really good material this summer.
Thank you.
Can I add on to what Alex said, just to keep it in line? The part about the budget, it's 7.4 million, and it's the biennium budget. The issue that we've got is that they're going to have a hearing on that very shortly, and then it goes to appropriations for correction. If you know of any of the representatives and senators and legislators, please talk to them directly, and tell them that the jails need this, especially out in our more rural counties. Without it, they're going to be sunk, and, well.
We're happy to work with you on an advocacy strategy that engages the LPC and our lobbyists to make sure we're all delivering the same material to our legislators.
Travis, best guess, will that occur prior to our next meeting?
A lot of that's going to happen within
Yeah.
the next couple of weeks, yeah. Yeah,
So-
I mean, statutorily, they need to be wrapping around the time of our next meeting, I think an extra week or so. I expect that the budget will be drafted by then, if not voted on. It's hard to say. Isn't the usual rush on it because they did an emergency budget. It could be the last thing they vote on, but I think that they'll have wrapped up the work in appropriations within the next couple of weeks, yeah.
All right, thank you. Sheriff Joyce?
Thank you. So update on hiring, like I mentioned, 5 in the academy, corrections officers, 5 scheduled for the next academy, 3 waiting medical clearance, and 2 of those are certified. So that's pretty good movement compared to pre-COVID. We had a class of 10. So the fact that we've got 5 is a little bit of a celebration. Law enforcement, we're down 7 people. We hired 3 people this week, one of which is not certified. Will have to go to the academy, so unfortunately, he won't hit the road until probably next year at this time, or maybe March-ish. But the other 2 are certified, so we're going to be purchasing them, and it's instant gratification. We have 3 other blue pens that have applied, and we're putting them through the process as well. So that's good news as well, because of the fact that that will be 5 certified people that we can put right on the road, and it'll be helpful. I think that's due to the last CBA that was passed, and some of the salaries and incentives to get people to come over. But I also have to credit the union for a couple of years ago, bringing to our attention that what if we went to mandate or fixed shifts and somebody had a part of the weekend off. We started as a pilot project about 2 years ago. We tried it over 6 months, excluding the contract deputies. It was just general revenue. We were skeptical, but it tended to work out real well, and we have since made that permanent and moved the contract deputies into that too. So we have deputies either working Sunday through Wednesday with an overlap on Wednesday, and then Wednesday through Saturday. So somebody, deputies are getting either Friday, Saturday off or Sunday. And I think that's been something that's been a great recruitment. And then probably lastly, the retirement has come a long way since many of us started. So that's attracting a lot of young kids as well. So I would like to say by the next time we meet, we're probably well on our way to having maybe 3 more fully certified people on, and that will cut us down to 1 vacancy, which is good these days, considering a lot of law enforcement agencies are having trouble. But I also have 1 individual that's retiring in September, so that'll be short-lived. We'll be up to 2. So we're plugging along.
With coverage for summer vacations, are we going to have enough bodies to do that? I mean,
Everything's a challenge. I mean, we fight with FMLA, military deployments. We've got 1 in law enforcement. We're going to try. Right now, I feel like we're a little bit better off this year than we were last year. But we have to get some of those ones that need to get to the academy trained, and then move these other 3 along. So, I've learned in the last 3 years, take it 1 day at a time, because in a New York second, things change.
how long will it be, or when will you know if you had to do an in-house academy?
Well, we were hoping by the 1st of May we would know what the next cycle
Right.
of training is. And there was an email, there was a virtual meeting the other day, because the academy would like to move all of the academy classes back to Waterville or Vassalboro. Right now, all of our people are going to Wyndham. That regional model is really the best, because it's a drive up there. We're within 50 miles of Vassalboro-ish, so the individuals can't stay up there, so they have to drive back. So that's adding an hour and 15 minutes to their day, 5 days a week over 6 weeks. So I'm waiting to get briefed on what that meeting was all about, and hopefully some insight on when the next corrections academies are going to be held. If we don't get any news on this, then we're probably going to work towards getting permission from the academy to run our own. Because we got 5, and, there are some things for a few weeks or even a month we can get done. We're not wasting time by having them review policies and learn some of the stuff that they won't learn in the academy. But, if we have to wait too long, then we'll start pushing for our own academy.
Thank you.
How many do you have to,
No, go ahead.
how many do you have to have an in-house academy?
Well, I mean, pre-COVID, when things were good, I didn't think it was worthwhile to do anything less than 7. 5 is a real good number, I mean, in these days. And like I said, we can use the time we have that they're not in the academy to take care of some of the stuff that they would have to do after they graduate. We'll just get it done front-loaded. But at a certain point, if it becomes unreasonable, then we'll start doing some training in-house. So I would say right now, we're at a point where I would advocate for it, but I want to see what that looks like, and without knowing.
What's going through my mind is I wonder if that's not kind of a recruiting tool, if you kind of let it be known to the market that you're going to create this academy, and they would have a chance to step in line rather than have to wait for 4 or 5 months or 4 or 5 weeks or whatever it is.
Yeah, and obviously we'd open it up regionally. I mean, if we've got 5, York might have a couple, DOC. I'm told that the academy that's going on now is like 20 or 23 people. So that's kind of the southern Maine area, which is pretty good. So, but I'm sure that everybody else got the same issue of trying to get them in. So my 5 today could be, a class of 10 if we can make it happen. But it all is contingent on the academy giving us the blessing to do that. So, and quite frankly, when we used to do it, we had a lot of staff, and you could bring in different people, so you weren't listening to the same individual all the time. We're going to be challenged, but I think we can do it, in doing our own. Because, again, if we're doing a regional, bring in regional instructors as well, so that you get a different face and a different voice for the 6 weeks. So it's doable.
Good, thank you.
Commissioner Rotonis?
Well, yes, Sheriff, regarding the new hire, for law enforcement, if they don't go to the academy, now, how long out is that? And would we lose him or her because it's taken so long to get them through the academy?
No.
So are they hired and they actually are working?
Yeah, we'll find something for them to do non-law enforcement related. I mean, the academy starts mid to late August. So if this individual was to get frustrated, he'd still have the same frustration of going to another agency, because
Right.
the next academy is August.
Okay.
So we're just going to get creative on what we'll do. But he's in the military. He's finishing up. So I don't think, even though we've hired him, he starts officially until either June or July. So that's okay with us. And then that will give us about a month and a half to buy the uniforms and get everything taken
Okay.
care of.
I just hate to lose him or her.
Yeah, no, I don't, I mean, I don't think we're gonna. He's pretty hopped up on
Okay.
the job.
Very good.
Thank you.
Thank you, Sheriff. And during our workshop, we're going to be focusing on the cross concern, Serena, but do you want to offer any comments on an update from there, or you just save it for the workshop? Workshop. Okay, that's fine. Catherine? Commissioner Kluger.
I have nothing, thanks.
Excuse me? What did you say?
Well, did I mention the Red Sox?
This is a first in the annals of Cumberland County. Commissioner Matonis.
No, I don't have anything either.
Commissioner Gordon.
Well, most of mine was politely covered by Travis. I don't have anything else to say.
Commissioner Smith.
Did I mention the Bruins? I'm still mourning, the Bruins. Nothing this evening, thank you.
Just a few comments. Want to wish all the mothers out there a happy Mother's Day. You are the certainly the bond that keeps your families together, the engine that makes it work, and we all appreciate your efforts each and every day. So celebrate your day and with your family and enjoy it. Congratulations and continued good luck to all the spring high school sports teams out there as they gear up in the middle of their season, and hopefully families can get out to support them. Not to be too redundant, but tonight as we allocated the remaining of our ARPA funds, it really was a historic event for our Cumberland County. We have, the sum is at $47 million.
57.
$57 million, I thought it was. $57 million allocated through the ARPA program that have gone to provide great facilities and services in our county, which will be the foundation for a number of projects for hopefully years and years to come. And so for all the executive staff that was involved, all the people in Cumberland County and throughout the county, give yourself credit, and it really was a historic event. Major, do you have any comments? I believe that's it. And so that is the end of our meeting. We have a workshop scheduled afterwards.
Will we adjourn?
Second.
All those in favor, aye?
Aye.
We adjourn.